Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's briefing. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we're reporting 2 new cases of COVID-19, 1 case in the Eastern Zone and 1 in Central Zone. Both new cases are related to travel outside of Atlantic Canada. There are now 29 active cases in our province, and we are keeping the numbers down, and I want to thank all of you for that. We also know with COVID, the cases can spike very quickly and unexpectedly. Just look what's happening in our sister province next door, New Brunswick. That province is experiencing its largest outbreak of COVID with cases spread across the province. I feel for New Brunswick and I wish them nothing but good luck. I wish the province well as they try to tackle this virus. But today we are announcing that we will be tightening our border with New Brunswick. Effective tomorrow at 8 a.m., everyone coming into Nova Scotia from New Brunswick will have to isolate for 14 days unless they are coming in for work, a medical appointment, or legal reasons. This also applies to anyone from Nova Scotia going into New Brunswick. You already have to isolate in that province, but when you come home, you will also have to isolate again here. We will be tracking this through our online digital safe check-in form, but what we're saying here is do not go to New Brunswick, and New Brunswickers do not come here unless it is essential purposes. We will stay in touch with New Brunswick and monitor their numbers and, of course, our own to determine when we can lift this restriction. But for now, anyone going in or out of New Brunswick will have to isolate for 14 days. Most of the other restrictions we currently have in place will stay in place for at least 2 more weeks. Dr. Strang will give you more details. Over to you, Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And before I start, a number of people online have been wondering if my health is okay. I've got a bit of a reaction on my head. I'm fine. My health is good. I'll let people know what's happening. So people may recall that I had a skin cancer treated in May as a result of some long-standing sun damage. I don't have a lot of protection on top of my head. The dermatologist has recommended I use a topical treatment to deal with some of the residual skin, damaged skin, which has a small risk of turning into a cancer. So I'm doing that. One of the normal side effects is the redness that's appearing. So I just thought I'd let people know that. You don't have to worry about me, but I really appreciate people expressing their concern. So thank you. Today we are reporting 2 new cases of COVID-19, 1 in Eastern Zone and 1 in Central, and both are connected to travel outside the province. Since October 1st, there have been 437 cases in total, and 408 are now considered resolved. This leaves 29 active cases of COVID-19 across all 4 health zones. Unfortunately, no one is in hospital. This week has started to paint a picture of the impact of the holiday season and what it's done related to our COVID-19 numbers, but it is still early. It's been 2 weeks since Christmas, but only 1 week since New Year's. The good news is that the numbers are still encouraging. Most of our cases are linked to other known cases or to travel outside of the province, and the number of close contacts and potential exposures with cases continues to stay low. But we need that to continue. We need to keep our public health measures and our common sense approach in mind as we return to our new COVID normal. We've always taken a cautious approach when it comes to COVID-19 in Nova Scotia, and it's paid off. And our reopening after the holidays will be cautious as well. I'm sure that many of you have been watching this week as our neighbors in New Brunswick have announced several days of double-digit new COVID cases. They are following several large clusters related to social activities over the holidays, and they're now back to strict public health measures province-wide. And as the Premier said, this is why, effective tomorrow, January 9th at 8 a.m., anyone coming in from New Brunswick will need to complete a 14-day quarantine when they arrive in Nova Scotia. We recognize that there are people who travel regularly across the border, particularly between Amherst and Sackville or Moncton for work. And like we did during Wave 1, we'll make exceptions for them. We'll also make sure that healthcare workers are able to get to where they need to be that people can still get necessary medical treatment by coming into Nova Scotia, and that legal child custody arrangements will be able to be maintained. But for now, we're asking that it's only essential travel from Nova Scotians into New Brunswick. I know that there's a lot of people in Nova Scotia with family in New Brunswick. And so we say if you were in New Brunswick and have come back to Nova Scotia within the last 2 weeks, we're asking you to isolate immediately and go online and book a COVID test, even if you don't have symptoms. You need to remain isolated until you get a negative test result. But once you hear back with a negative result, you can go about your business as usual. There's no need to isolate further. But we do also recommend a follow-up test 5 to 7 days after your first test. And if you had visitors from New Brunswick in the last 2 weeks, please, everyone in your household who was visited, go online and book a COVID test. And in this case, you don't need to isolate until you wait for your test result. The border restrictions and then the need for quarantine apply to New Brunswick only. At this time, we are not making any changes for travelers from PEI and Newfoundland. So if you're coming from PEI and Newfoundland, you won't need to quarantine. And if you're coming from PEI and driving directly through New Brunswick to get to Nova Scotia, you won't need to quarantine, but you need to drive directly. Don't stop for gas or food in New Brunswick. As the Premier said, Nova Scotia schools will reopen to students on Monday as planned. The community use of school gyms for evening activities can resume as well, as long as these activities follow the province-wide restrictions in the public health order. School-based activities, whether they're sports or arts and culture, need to follow the same rules. So that means there are no more than 25 people for a sport activity or for a music group or a theater group. And it can be for practices and rehearsals only. So for now, we won't be resuming sports or any kind of arts activities that involve connection between schools. I also have some good news about music education in our schools as well. We know that music education is an important part for students' education and in life in our schools, and that COVID-19 has had a big impact on those where playing an instrument or singing is important to them and has been part of their normal school life. So members of my team in the Department of Health and Wellness have been working with the Department of Education and Early Childhood Development to look at how we can increase access to music education in a COVID-safe way. And I'm pleased to say that we've provided updated guidelines to schools to allow that. We believe that these guidelines will allow for increased access to music education in a safe way. And we will continue to monitor and update this guidance as needed. So starting Monday, these new guidelines that allow some singing and playing instruments in a modified way will be in place. We know that having children and youth learning in school is a priority in Nova Scotia. And to do that, we need to make sure that the communities around our schools are safe. As we said when we opened schools last September, the way we keep our schools safe and open is by keeping the communities around them safe as well. That's one of the reasons why we are extending the current restrictions that are in place for another 2 weeks. So the restrictions that are in place that expire on midnight this coming Sunday are extended now and will be in effect until midnight on January 24th. There are, however, a few exceptions. As of Monday, this coming Monday, January 11th, the Halifax Casino and the 3 First Nations gaming centers in Halifax that were ordered closed can reopen. The 3 First Nations gaming centers are not licensed to serve alcohol, so they can operate within their usual hours. Both the Halifax and the Sydney casinos are licensed establishments, and so the same rules apply to them as to all other licensed establishments and restaurants. That means that they must stop serving food and beverages by 10 o'clock and close entirely by 11. And of course, the casinos and the gaming centers have to continue to follow the public health measures, the COVID protocols that they put in place when we reopened them after Wave 1. Also, starting on Monday, retail operators can increase the number of customers from 25 to 50% of their maximum legal capacity. But the rest of the restrictions that were introduced before Christmas will stay in place. So we need to make sure for these retail establishments. So they need to continue to make sure that staff and customers are able to maintain distance while in the store, that if there are customers lined up outside the store, that they are physically distanced. Mask wearing is required inside the store as well as in outdoor lineups. And we continue to ask them to keep music at lower than 50 decibels. We know that if in loud environments people talk louder to be heard, and that increases the chance of spreading a COVID virus. Like I said, all other restrictions will remain as they are today until midnight on January 24th, or technically 11:59 p.m. on January 24th. Keeping things as they are for at least 2 more weeks will give us a chance to really see the impact of the holidays. What has been the impact of more shopping, more travel, and more gatherings? Our approach is a cautious one, and we're going to continue to be cautious through the month of January until we can be sure the impact of the holiday season is behind us. And you don't need to look far to see why we're choosing this cautious approach. We've already talked about the surge in COVID activity in New Brunswick, but if you need to look a little further, look at Quebec. They now have a strict curfew in place for everyone across most of the province. People have been ordered to stay home from 8 p.m. to 5 a.m. In Ontario, several communities are reporting that their hospitals are at capacity. Their ICUs are full. Their healthcare system is now setting up tent hospitals and temporary morgues, and they're planning for things to get worse, not better. We cannot take COVID-19 lightly. If we allow it to spread freely, it will have significant impacts on the whole community. Our best chance to prevent this from happening here is to continue our cautious and balanced approach. I know having restrictions in place is tough. It's hard for people, it's hard for families, it's hard for businesses. It's hard on communities. But I hope you can look at what's around us and see how hard that is as well, and that is exactly what we need to work together to avoid. I know that 2 more weeks of tighter restrictions isn't the news you're hoping for, but it is the right approach to keep us all safe. And for now, we need to continue to focus on the essentials, keeping kids in school so they can learn, allowing small gatherings within our consistent, close family or social groups. So getting together, social connection is important, but we need to continue to do that in small and cautious ways. We'll continue to allow to visit loved ones in long-term care facilities, but again, doing that cautiously. And we're going to continue to allow people to be both physically and intellectually active by allowing small groups of up to 25 for theater and sports, for rehearsals and practices, by allowing libraries and museums to be open, helping people to connect within their communities. But I ask people that we need to remain focused on keeping each other safe. For our elders, for our neighbors who have serious health conditions that we may or may not know about, for our healthcare workers who continue to be there for all of us when we need them, and for our grocery store, waste collection, police officers, firefighters, and other essential workers who continue to be prepared to serve us. Because it's the necessary and right thing to do, and it's because we care for one another. If you do need to have a refresher on what all the COVID restrictions are, you can go to our coronavirus website, which is novascotia.ca/coronavirus. Over the holidays, our compliance officers did more than 120 inspections at retail locations and bars and restaurants outside Metro that were still open. They reported high and in some cases exceptional levels of compliance. And in the handful of cases where there were compliance issues, operators worked with our teams to make changes quickly. So I want to thank both the retail sector and our bars and restaurants for their efforts and their sacrifices over the last 6 weeks. I know for the retail sector it wasn't easy to operate at a reduced capacity during your normally busiest season of the year. And I know that the temporary closures or limited hours have significant financial impacts on bars and and restaurants. But as Nova Scotians always have, since the pandemic began, these businesses have stepped up and found ways to continue to make it work, despite the financial impact. So I thank you for being part of the solution and for doing your part to keep our communities safe. Wearing a mask remains one of the most critical pieces to controlling the spread of COVID-19. And I want to take a minute to remind people that masks are mandatory in all indoor public places for everyone except for the small number of people who have a true medical reason why they cannot wear a mask. But for everyone else, you need to wear a mask and wear it properly. It means it has to be on and over the nose and the mouth, not just the mouth. We also recommend wearing a mask at any time, whether it's indoors or outdoors, that you're not able to reliably keep a 6-foot distance from people outside your household or established close social group. And it's for outdoors and indoors, but it's most important for indoors. And this includes people who receive home care. Home care staff already are required to wear masks when they visit people's homes, but the recipients of home care need to wear one too. Unless they have, a valid medical reason that they cannot wear a mask. We're hearing reports about concerns by home care workers that the people they're providing care to are not wearing masks. So if you're receiving home care, or if anybody else who's in the home and is in close proximity as that care is being delivered, then those people also need to wear a mask, not just the home care worker. We talked a lot about vaccines on Tuesday, but I just want to give a quick update on our program rollout. This week, we received another 3,900 doses of the Pfizer vaccine, which has gone to both the Cape Breton and Valley Regional Hospitals. We'll be starting clinics for healthcare workers, both acute care workers and long-term care workers, in both of those locations on Monday. And these will be the first clinics to administer COVID-19 vaccine outside of Halifax. We anticipate 2 more shipments next week, 5,580 doses of the Pfizer vaccine and another 3,700 doses of Moderna vaccine. Some of the Pfizer vaccine will go to Colchester East Hants Health Centre, so a clinic for healthcare workers can start in that area, and some will go to Cape Breton to start immunizing in a long-term care facility in the Cape Breton area. I'm pleased to report that we'll be able to start immunizing long-term care residents as early as Monday in the Halifax area. This is a week earlier than we had originally planned. And the first residents to start receiving the vaccine will be at Northwood's Halifax and Bedford campuses. And again, good news. Initially, we thought we'd only be able to start vaccinating in the Halifax campus, but in working with Northwood, we would now be able to make sure that we can vaccinate in both of their campuses. And we are working with Shannex Parkstone location and Ocean View to begin vaccinating staff and residents and designated caregivers in the days to come. We'll announce more details of that as we finalize those plans. And as more vaccine arrives, we'll be able to provide more long-term care facilities across the province. As was talked about earlier this week, we'll begin reporting numbers of the doses of vaccine administered on a weekly basis starting on Tuesdays. But for today, I can say between December 16th and Tuesday, January 2nd, we have administered 2,720 doses of vaccine. And again, we'll have updated numbers at our daily briefing next Tuesday. By the end of next week, we'll have received 23,000 doses of vaccine, which is enough to immunize 11,500 Nova Scotians. I know there's a lot of interest out there in the COVID-19 vaccine in our program, and I want to reassure people that we are working hard to put our vaccine program in place and to have it rolled out across the province. Our first phase, as we've talked about, which has limited vaccine supply and runs until the end of April, is focused on those at highest risk of COVID-19. staff and residents in long-term care facilities, healthcare workers directly involved in the COVID-19 response, and seniors 80 plus of age. We anticipate getting much more vaccine beginning in May, and this will allow us to shift our focus to community-based immunization and less of a need for strict prioritization. Our key goal, and the one we need Nova Scotians to focus on, rather than where they exactly fit in terms of timing, is that to have everyone who wants a vaccine immunized by the end of September. I know this seems a long way away, but it will move fast. And I know people are eager to get vaccinated, but again, I'm going to ask for people's patience. We will get to you. We'll roll this out, but it'll take time. The first phase is really about high priority groups, as well as trying out different models of vaccine delivery. So when we do get increased amounts starting in May, as we anticipate, we are ready to go with much larger community-based clinics to allow us to meet the demand and use the vaccine that we anticipate getting. We have been literally flooded with requests from individuals and groups reaching out, lobbying for prioritization, whether it's because of their job or because of their medical status. I want to assure everyone that we know who the highest risk groups are, and we're making decisions with that risk in mind. You don't need to reach out to us. The fact of the matter is that responding to all these requests right now is taking us away from the work we need to focus on, which is developing the program and getting the COVID vaccine out to communities. So before I wrap up today, I want to take a moment to remind everyone about the mandatory 14-day quarantine for university students who have returned or will be returning to Nova Scotia after the holidays. We are doing asymptomatic testing for these students between days 6 and 8 of their quarantine. And just this week, we identified 2 positive COVID cases through this asymptomatic testing stream, and that highlights the importance of this testing. I know that the 14-day quarantine for students is tough, but the reason we have it in place is to detect COVID cases as early as possible. Many people, especially in this age group, may have COVID without even having any symptoms. And we know that university students, when we started doing the rapid testing pop-ups before the holidays, were among our university students in Halifax and other communities were among the first to take advantage of that and to heed the call to come out and get tested to help protect your community. And many of them said it was a way that they felt that the only way they saw they could for them to contribute to our COVID response. So I remind students about that and ask them again, those who are quarantining, that please take advantage of the opportunity for a test during your quarantine period. I know many of them are, and I thank them for doing that. Doing this testing along with sticking with your quarantine will make a difference in keeping our community safe. And with our elementary and secondary school system opening back on Monday, I want to take a moment to thank everyone who's helped make this school year a success so far. Not just staff across our school system, but parents and other caregivers as well. We know that having children and youth learning in school is optimal for them, for their education, for their physical and social development and their socialization, and for many for their mental health. And it's due to their efforts that we can, it's all our efforts, as I said earlier, that keeping our community safe will allow us to keep our school safe and keep our children and youth in school. And I do want to just have a message directly to children and youth in our schools. I want to thank all of you for what you've done so far as part of our COVID response. You're in school during an extraordinary time. We've asked a lot of you this year, and you really have stepped up. You've worn masks, you've stayed in your cohorts, you've washed your hands, you've followed all the other rules in order to help keep school safe. And because of that, they have remained safe. But we're not through COVID yet. We need you to keep this up, not just when you're in school, but all the time, when you're at home, when you're in your communities. In school and outside of school. That means wearing your mask and wearing it properly. I'm sure you've heard this a lot, but wearing a mask is very important. You need the mask to cover your nose and mouth fully and fit snugly around your face. Washing your hands often or using hand sanitizer when you can't is important. And remind your friends and classmates to do this. We need to protect each other and have each other's back. That means not singling out or being mean to people who test positive or may be suspected of having COVID-19. This is not a time for shaming and blaming the people around us. It is a time for compassion and understanding. It's a time to keep being the leaders that you have been all the way through this pandemic, in your homes, in your schools, in your communities, and to show us adults what leading with kindness looks like. So good luck on Monday when you head back to the classroom. Be safe, be smart, and be kind to one another. Premier.
Thank you, Dr. Strang. And Tina, we'll be happy to take any questions.
Just a reminder, we'll take one question, one follow-up from reporters on the line in the allotted time that we have for today's briefing. We'll start with Graham Benjamin from Global. Go ahead, Graham.
Hi, thank you. Just a question for the Premier on the new travel restrictions with New Brunswick. I'm just wondering why this decision is being made now in reaction to the spike in cases in New Brunswick and not back in November when the provinces announced they were leaving the bubble.
Well, it's the epidemiology of what's happening in New Brunswick today, and working with our own public health team here and Dr. Strang, it was felt that putting these in place at least for 2 weeks till we get a chance to look at what's happening in New Brunswick, it would be the appropriate thing to do. If you go back to when we started in September, when they left the bubble, it really was because we'd announced community spread here. It had nothing to do with what was happening in the sister provinces.
Go ahead, Graham, with your follow-up.
Thank you. And just switching gears here to the vaccine for Dr. Strang. Just during that last briefing, you spoke of the different professions that can help with the distribution of the vaccine, and you mentioned we need to start the conversation with those groups. I'm just curious as to where those consultations are at right now, and exactly when you believe those in need and other healthcare workers will be immunized. If that's the first phase or the second phase.
So I was part of a meeting with there's a network of regulated health professions, and we joined one of their meetings yesterday, myself and ADM Barbrick, to start the conversation with them. Very positively, very well received. What we position with them is that help them understand when they may be eligible for vaccine as healthcare workers, but more importantly, it was, as I just went through in the briefing, it'll be into May when we get much more substantive amounts of vaccine that we have to, have we'll need their support to be able to do community clinics across the province. But we need to start the discussion with them now and how we potentially see them being involved. And as I said yesterday, we started at a very productive first discussion with them, and we'll continue that in the weeks ahead as we get more and more into the details of planning for what may be in place for May.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, Dr. Strang. I wondered if you could tell us what is it about the way COVID-19 is spreading in New Brunswick that is most worrisome to you right now?
Well, I think we have to, it's simply that it's nothing new, but it's simply that even seemingly innocent social gatherings over the holidays have led to substantive spread. What it points to is how, unless people are very cautious, the virus can spread very quickly to large numbers of people, and that's what we've seen, and that's what we have to be cautious about. It doesn't take much to go from a very controlled situation like we've had to be, as Dr. Russell said yesterday, a very grim situation in New Brunswick. The same thing happened a few months ago in Manitoba, and so that's to me the main point is why we continue to need to remain vigilant and not let our guard down and become relaxed, because things can turn around very quickly.
Go ahead, John, with your follow-up.
And I just want to be very clear, because I have to admit some of this stuff goes by pretty fast. Did you say that you were easing some of the restrictions in terms of restaurants and retails? And if that is the case, and you have also said we still need time to see if COVID has spread during the holidays here in Nova Scotia the way it has in New Brunswick, why would you be easing any restrictions before we know the answer to that question for sure?
So the only two things we're easing, Jean, are we're allowing the Halifax Casino and the First Nations gaming establishments that were in the Halifax area that were completely closed. We're allowing them to open up so they can be on the same footing as other gaming establishments across the province. The casinos, because they're licensed establishments, aren't open late night. They have to close by 11 like all other licensed establishments. So that seems a very reasonable approach. The only other thing we're loosening off on a bit is we're allowing retail environments to go from 25% to 50% of their maximum capacity. All the other COVID protocols that are in place in stores have to be maintained. So that seems a very, to me, a very low-risk way to allow them to accommodate some more business. They were very tightly restricted over the holidays, significant impacts, but it's not introducing a substantive risk in my mind for COVID spread. All the other restrictions, no gatherings except for faith gatherings and wedding or funeral services, groups of 10 within your home, all the other things that tightly restrict social activities, which is our main area of concern, remain under strict restrictions.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, is there any evidence yet that the COVID variant may be in Nova Scotia?
We have not seen any cases. We continue to be on the alert. We've sent at least one case off for the testing. We've developed criteria with the medical officers of health on cases that are suspicious of potentially involving the COVID variant. Of course, travel-related ones will automatically, with appropriate travel, will automatically be sent. But there's other ones where we may see an indication of faster than what we'd perhaps expect kind of spread. Those other kind of indicators where we already have it in place with the lab. We'll flag those specimens and we'll make sure that they are sent off to the national lab for testing.
Go ahead, Natasha, with your follow-up.
Thank you. Just one other question, too. Why, I guess, can you explain the rationale behind deciding to open up the casino and increasing capacity at stores but not having organized sport games right now?
Well, we know that we certainly know the respect and understand the importance for people to be physically active. That gyms remain open with their 50% capacity, allowing sports teams to practice. But we know that as soon as you allow competitions to happen, you increase the social interaction, not just between two teams, but also in the spectators, parents, etc. So this is, again, as I've said many times, COVID, our response is about a balance. We want to give people safe opportunities to be physically active. We also want them to be intellectually active, so we've got libraries and museums opened. But what we've said, it introduces too much risk on the social connected side if we allow competitions. So that is I think that's a very reasonable balance. Keep sticking with our priorities of small social interaction, of having kids in school, allowing people to be active physically and intellectually, but not opening things up broader. And it comes back to how we need to be very careful and strict about our social interactions.
Next, we'll go to Danielle Edwards from the Canadian Press. Go ahead, Danielle.
Hi. Just jumping off about that question of the variant that came out of the UK. I just wanted to ask if the province has a plan set up in case the variant is identified here.
Well, there's not, beyond making sure you're testing for it, your COVID response doesn't change at all. All the normal COVID restrictions would be in place. How we respond to individual cases, isolating cases, quarantining contacts, testing, et cetera, would be exactly the same. We also, in our immunization program, will roll out regardless. So it really is about, the most important thing is working with our federal colleagues around making sure that we have the appropriate restrictions on international travelers, and then testing people with the genotype testing to make sure we have a surveillance system in place for these specific variants. The rest of our COVID response doesn't change.
Go ahead with your follow-up, Danielle.
Yes, and I also want to ask about Nova Scotia allowing people from PEI or residents of PEI in Newfoundland to travel into the province without having to isolate. Are there any concerns about keeping Nova Scotia as the sort of the last remnants of the Atlantic bubble open to any of the provinces, or there perhaps plans to close it off as other provinces have?
This is based on epidemiology. We've worked really hard to try to keep, things as open as possible with our Atlantic neighbors. And we did so with the reason we're not able to do that anymore with New Brunswick is simply because of their rapid spike in cases over the last, which began earlier this week. We have not seen the same spike in PEI in Newfoundland, so there's no need to put the quarantine for those residents. If they do have a change in their epidemiology, we'll respond if necessary, like we've done with New Brunswick.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, I'm just wondering about the exhilaration of the immunization plans. For instance, next week you're going to be moving into long-term care. I'm just wondering what's behind that. Have we received more vaccine than expected?
No, our vaccine is on track. It's more as we've worked through some of the logistics, as well as working with Northwood and their ability to receive vaccine and immunize folks. Everybody is understanding the urgency of this and getting things in place as quickly as they can. So it's good news that the work we're doing to develop procedures and protocols, people are trying to move that along as fast as possible. And fortunately, we're able to speed up our time frame for beginning long-term care immunization.
Go ahead, John, with your follow-up.
Thank you. This is also for Dr. Strang. There have been concerns raised about a restaurant in Lower Sackville that reportedly is not requiring customers to wear masks, like on the way to their tables, that kind of thing. And the owners have been pretty blatant on social media about their refusal to obey this rule. We're just wondering, does public health investigate businesses that don't follow the rules, particularly in such a blatant way?
Absolutely, I'm aware of that. We've already asked that we send out our restaurant and occupational health and safety inspectors to that establishment today. If we become aware of that blatant disobedience, we'll act very swiftly.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you very much. I'm asking for Dr. Strang. You've described the lower risk for Prince Edward Island and Newfoundland travel and why you'd like to keep the Atlantic borders open. Do you have any concerns about residents from PEI or Newfoundland catching COVID as they drive through New Brunswick coming into Nova Scotia?
Well, first of all, people from Newfoundland aren't going to drive through New Brunswick to get to Nova Scotia. If they're coming from PEI, that's why we've said, don't stop. Cross the bridge. You can drive through in about a half an hour, if my recollection is right, to get to the Nova Scotia border. So as long as you drive right through, you're not going to catch it just by driving through for that short period of time.
Go ahead, Lindsay, with your follow-up.
Thank you. Regarding the vaccines being administered at Northwood on Monday, I'm wondering if you can say how many vaccines you anticipate to administer a day there, and if you can tell us a little bit more about the process of transporting the vaccine to those facilities for those clinics.
I don't have the details of exact numbers involved. We're starting there. We now have the process, as I said on Tuesday. The vaccine has to be shipped frozen. It's in specific containers with ice packs, etc. And we had to do a couple of trials around to make sure we had it packaged the right way so it can maintain that temperature. I'm not involved in the specific details, but it's specific. Transportable portable freezers along with dry ice, etc. That is involved the vaccine inside, of course, to maintain the appropriate temperature as it's from our depot in Burnside to the two Northwood campuses, and then soon to the other long-term care facilities as well.
Next, we'll go to Drake Lowthers from the Port Hawkesbury Reporter. Go ahead, Drake.
My question's for Dr. Strang. I guess the past 2 days we've had 2 contact cases in the eastern zone. Were those from the case at St. FX?
No, we've had no further positive tests as a result of our testing on that campus.
Go ahead, Drake, with your follow-up.
And do we know if all the students from, I guess, the first semester actually did take their mandatory tests? I guess sort of saying it will, is there a chance that any will sort of sneak through this time since they're only required one rather than the 2 last time?
We had the majority of students. I don't have all the numbers in front of me from that testing in the fall or late summer, but we do know the majority of students complied with the requirement for testing. We would hope that now it's a one-time testing, that there's an even higher compliance with that.
Next, we'll go to Zane Woodford from the Halifax Examiner. Go ahead, Zane.
Hi, the federal government is starting to immunize prisoners at its institutions today, including Spring Hill in Nova Scotia, sort of as a pilot, starting with elderly prisoners and those with pre-existing conditions. What's the plan for getting COVID vaccines into provincial jails?
I haven't had it. I know it's on our list of around priority groups. We can get back to you in the details of that. I don't have that top of mind for myself today.
Go ahead, Zane, with your follow-up.
There was an announcement today about wastewater testing for COVID. Can you talk a bit about how you'll use that data and how public health is working with the researchers?
So, 2 things. I'll answer your second question first. So, we have an advisory committee for that research. One of the medical officers of health, Dr. Cram, is on that advisory committee to make sure that there's a good flow of information from the research group to public health and to clinicians, so we can make sense of it and say, well, what is it really telling us? This is a research protocol for a reason, because nobody around the world is still really fully certain on what does this type of testing of wastewater actually tell us. But there are some early signs that it's a good addition to our overall surveillance on what is the presence of COVID in communities. Of course, with this type of testing, you could never trace it back and attribute a positive test in the wastewater to any one individual, but it's quite likely that it could be like an early warning signal that as we're testing wastewater and we're getting negatives, and all of a sudden we start to get positives, it could well be an early sign that we now have to have COVID in the community, and then what we would need to do is then bring in, enhance our testing of people within that community to validate that. So that's our thinking on this, but it is a research project for a reason. We will learn from it and say longer term, what is the role of this type of wastewater surveillance as part of our overall testing and surveillance strategy.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. So, Dr. Strang, I'm, wondering what advice you have for any Nova Scotians who might currently be in New Brunswick, especially as public schools aren't back in until Monday. I'm sure there were people who traveled there for family over the holidays and haven't returned yet. Is it just get back ASAP? If they get back today, they won't have to isolate, but they will still need to book a test? Is that what it is?
So what we're saying to people who, if the quarantine comes into a place, 8 o'clock tomorrow morning, if you happen to get back earlier, then we're saying to people who have been in New Brunswick in the last 2 weeks that they should isolate at home and go online to book a test. And also, if they've had people from New Brunswick visiting them over the holidays, they should also, now everybody in their household should go online, book a test. For the first group, if people have actually been in New Brunswick, rather than just having a visitor here, because being in New Brunswick increases their risk, we're saying that you need to isolate until you get a negative test. If you just have visitors from New Brunswick who've been in your home, you don't need to isolate while you're waiting for your test result. It's important that we're asking Nova Scotians now to avoid any non-essential travel to New Brunswick. So if they are in New Brunswick now, they need to listen to that, and now's the time to come home as quickly as possible.
Go ahead, Victoria, with your follow-up.
Thanks for reiterating that. I appreciate it, Dr. Strang. In terms of vaccines, we've talked a little bit about the clinic that'll be starting next week at long-term cares, and I know you said you don't really have estimated numbers of how many per day could happen at that. But in terms of the vaccines that have been given out so far at the Dalhousie Clinic, previously I think you said you were hoping to get 300 or 400 people per day. Was that the turnout that we saw at those early clinics?
Yeah, we've had maximal turn. I think their maximum capacity is 400 a day, and we've met that target. We've continued to work with the Nova Scotia Health Authority and with long-term care facilities. Every day there was a roster of people who were up next to get vaccinated, and if some of those people weren't available for some reason, we then went down the list further. We're not going to have vaccine or vaccinators sitting around inactive. So we worked very efficient in terms of the way those clinics ran to maximize their utility.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thank you. I'm wondering, with the changes regarding travel for New Brunswick that come into effect tomorrow, how will the land border look and operate compared to the way that it has for the last few months? Are there going to be more people staffing the border? Will cars be stopped individually and checked? How exactly is that going to look and function?
I haven't been involved in the details. There were discussions yesterday with Nova Scotia Environment, who was responsible for that border control. They'll be doing things, turning to back to what they did back in the first wave when we did have the same quarantine for people coming not just from New Brunswick, from PEI. But we can get back to you in the details. But it'll look very similar to what I would assume is going to look very similar to what it was back in Wave 1.
It will look very much like it was in Wave 1, where there will be a line for essential service that we had, where medical people are coming across, people coming for work. We'll have one lane, and then those that will be required to stop. Everyone will be required to do the online program, which will identify where they're going, and they'll have to communicate that to the people that stop them.
Go ahead, Mike, with your follow-up.
Great, thank you. Dr. Strang, you mentioned that you've reached a point now where you can allow music activities in school. I think you described it sort of a modified approach for singing and playing instruments. What is it at this point that has you comfortable about permitting that? And can you provide any more details about what exactly that's going to look like?
So it's a guidance document that schools have. We can get that to you later if you need the details. But it's simply, when we looked at it, was about how do we do things that allow singing an instrument safely, and it is based on making sure that there's physical distancing in place, limiting numbers, limiting the time, the length of classes, things like that. We recognize that people had raised a legitimate concern that sports physical activity was allowed, but we weren't allowing music at all. And so we've worked with our colleagues in education to essentially make both the music, the arts type curriculum on the same footing as sports physical activity, both of them done in a way that has the necessary COVID safety, always based on things like physical distancing, masking where it can be achieved, those kind of things.
That's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. Monday is a big day in our province as schools will begin to open again. To parents and caregivers, thank you for accommodating the extra week. We're hoping this will provide an extra layer of safety for our students as they go back to class. To teachers, staff, and students, I know some of you are worried about COVID lurking around the corner. There is no guarantee, but we are doing the best we can to keep everyone safe inside of our schools. But it's our behavior outside that will also protect our teachers and students. I know we're tired and complacency can set in, but following the protocols is working. So we need to continue to wear a mask, keep our distance, wash our hands, and stay home when we're not feeling well. The vaccination program is rolling out. That will continue as long as vaccine keeps arriving. I have confidence in our healthcare teams to distribute this vaccine, and I have every confidence in our teachers and principals to provide the best education possible to our kids. The circumstances are difficult, but you've got this. Have a great weekend. Get back to class, keep learning, keep following the protocols, stay safe, and be kind.